Yes, thank you very much, and good morning to everyone listening. My name is Olivia Spivack, and I am a project manager for two European reference networks, or ERNs, one of which is ERN Cranio, which is the network for rare and/or complex craniofacial anomalies and ear, nose, and throat disorders. The coordinating centre for this network is the Erasmus Medical Centre in Rotterdam, in the Netherlands. As some of you will be aware, ERNs were launched in 2017 by the European Commission against the backdrop of the EU Directive on Patients' Rights in Cross-Border Healthcare. ERNs are networks of expert healthcare providers from across Europe. There are 24 networks, each focusing on a different rare disease area, and many ERNs are represented here today. It is recognised that individuals with a rare and/or complex disease may struggle to obtain an accurate diagnosis and/or appropriate treatment in their home country. There may be limited information available, and clinical expertise may be scarce and/or scattered. ERNs seek to pool together the available disease-specific expertise, knowledge, and resources from across Europe to support patients, families, and healthcare professionals working with these rare and complex conditions. ERN Cranio seeks to do just this for rare and/or complex craniofacial anomalies and ear, nose, and throat disorders. This action is supported by patient representatives, who, by representing the voice of their patient communities, can ensure that the needs and perspectives of patients are considered in network activities. Patient representatives within ERN Cranio have been reflecting on their own personal experiences and engaging with their disease-specific patient communities to identify the needs of patients and families at key clinical stages of a patient's journey. They have also identified ideal support scenarios at each stage. As you can see on the poster, this information is firstly inputted into a table template before it's converted into a disease-specific patient journey visual. And Matt Johnson from Euroaudis has supported this process. Patient journey visuals have now been developed or are in development for 6 diagnoses covered by ERN Cranio. The visuals can be continually shared, added to, and developed by other patients and families from a wider range of European countries. Patient representatives can also use these visuals to contribute and facilitate discussion with network clinicians in a structured way. The disease-specific needs and ideal support scenarios identified at each stage of the patient journey can be used to validate disease-specific network activities already completed or in development. They can also help to shape future activities and clinical priorities. In addition, we can consider mapping the patient journeys based on real-life experience against available clinical recommendations or guidelines. On initial inspection, it also appears there are identified needs and ideal support scenarios which are common to all the patient journeys. For example, there appears to be a common need for clear, easy to understand, medically accurate information on clinical diagnosis and/or treatment options. This identified common need serves to validate ERN Cranio's strategic focus on the development of clinical guidelines, which are defined as statements that include recommendations intended to optimize patient care that are informed by a systematic review of evidence and an assessment of the benefits and harms of alternative care options. What it also highlights, though, is the importance of ensuring these guidelines are made accessible not only to the healthcare professionals, but to patients and families too, with recommendations communicated in a way which is understandable and clear. This may involve creating a patient version of a medical guideline, for example. A more in-depth inspection and a systematic assessment of the common needs will need to follow. However, this initial finding just highlights the potential value of using the patient journeys to validate the network's strategic focus and shape priorities on a broader level. So thank you very much for listening to this presentation. We are delighted to have been selected for this award and to be given the opportunity today to showcase the hard work completed by ear and cranio patient representatives. Please do not hesitate to contact me if you have any questions. You can find my email address on the poster as the correspondent. Thank you.